Hi everyone, this is Dr. Pravut Patel, and today we're going to talk about how to select the perfect branch which suits you the best. So, without wasting any time, let's begin. So, you have cracked the NEET MDS and now you're looking for the perfect branch to join. You don't have a clue what to see, what not to see. Let me help you with this. The first thing you need to ask yourself, do you have any choice? Do you have any interest? You might have liked some subject during your internship. You might have loved doing patients in that particular department. You liked how the branch functions during the internships. You have a firm preference for that particular branch. If yes, then join it. There is no other question, just join it without even asking. If you're getting that branch in any college, join it. See a good college, join that branch. That's it, finish. If the answer for this question was no, then I have a plan for you. See, even after saying no, you might have some particular branches like clinical or non clinical, theory or more practical based, surgical or not surgical, branch based on the patient flow. Like you might open a dental clinic afterwards. So you need to see a branch which has most patient flow so to run a successful clinic. So for that, I have made a plan and I'll share it with you. See, the first thing you need to remember, your branch should come first before your college. Branch will be lifelong with you, and college will be only for 3 years. The only thing that comes with the college is the brand value. Like I'm studying in KGMU, so I'll have the tag that I did my MDS in orthodontics from KGMU. That's the only thing I'll be getting. But branch is more important than the college. Always remember that. You have decided between the clinical or the non-clinical branch. The clinical branches are ortho, OMFS, prostho, endo, perio, pedo. The non-clinicals, public health, oral path, and oral medicine and radiology. So if you are going for these three branch, like if you have a less grade, you can go for these branches. For public health, you can have a good clinical exposure. They will also organize camps and public relations, so you can have good public relation with the people. Highest chance of government job will be seen in this branch, like the medical officer jobs and the PSC jobs will go mostly to the public health department people. Research work is also too much in public health, so you will also have a good academics. According to me, it's like best of both worlds in the non-clinical branch, 50% clinical, 50% academics, and also getting a good government job. Also, you can run a proper dental clinic after doing public health, so it's a good branch overall. You can go for it. Moving on to oral medicine and radiology, like you will get to diagnose a lot of lesions, lot of diseases in the oral cavity. Like most of the general dentists will be limited to only leukoplakia, lichen planus, OSMF, but like oral medicine people will see more than this. They will know what medication have to be given in with and what treatment have to be done. Patient interaction will be very high, research will be high. Government job chances, I haven't seen much of the oral medicine and radiologists joining government jobs, and their jobs are not coming much frequently. See, I think oral medicine is a good department. It's good if you are already into clinical practice, like you are running a clinic, you know all the basic dental procedures, so you can do oral medicine and radiology and also learn the medication with it and practice afterwards. For oral path, it's a pure non-clinical branch. Least patient interaction will be there. Diagnosis, it's based on mainly on the diagnosis and analyzing branch. You'll be spending most time in the lab, more research you'll be doing. See, it's good if you are into academics, you want to become a professor or something like that, you can go for oral path. These were all about the non-clinical branches. What I think about the non-clinical branches is people who are already well versed with the common procedures of the dental clinic, like extraction, restorations, RCT, curettage, CD, should go for the non-clinical branches because they will get the tag of a MDS with the least of the work and the weight of the clinical branch. Moving on to the clinical branches. You like surgical procedures, you like blood-stained gloves, you want to be a Kabir Singh, you want to be a surgeon, go for the surgical branches. So there are three surgical branches according to me: OMFS, that is oral and maxillofacial surgery, Periodontology, and Prosthodontics. So if the answer is yes to the question, you can go for any of these three branches. OMFS and periodontology are more of a surgical branch. Prostho less because you will be doing only implant surgery and some minor surgeries. But OMFS is like the best of the surgical branch. Perio the second best. So I'll be comparing these three branches and telling who can join these branches. See, OMFS is like the best surgical branch which you can join in dentistry. It's more of a link towards the medical and the dental side. So it's like kind of a linking branch, and people will assume that you are a surgeon. Not assume, you are a surgeon. You'll be doing extraoral and intraoral surgeries. You will also be doing trauma, syndromic patients, oncology patients once you have done the fellowship with that. High chances of government job. I've seen many government jobs requiring a OMFS surgeon. Super specialty you can do in these branch like fellowship on cleft lip palate, trauma, orthognathic surgery, oncology, and much more. Implant placement, these guys can do. What my verdict is, it's a pure surgical branch. It cuts you from dentistry. That's the only downside of it. So you need to practice in hospitals and private hospitals and connect with them. Moving on to periodontology. Perio is like one of the most sophisticated branch for surgeries. Like they will be the master of lab. Like as an orthodontist, I'll send my patient for canine impaction or some exposure to periodontology. I think perio does a more sophisticated job at surgeries, minor surgeries, only intraoral surgeries. Periodontology in some of the colleges, perio people will also practice basic dentistry. So it's like a best of both worlds branch. Government job chances are also there. I've seen people being periodontist and getting selected in the government jobs. There is no super specialty after periodontology, so that's the difference between OMFS and the perio. Implant, yes, these guys also place the implant and also see the along with the placement they will also see the rehabilitation of the implants if the implants are failing. See, perio, it's not much of a preferred branch, but it still is a surgical branch. Implant is an added advantage to it, so if you want to go for perio you can go for it. Moving on to prostho. The only surgical item of this branch is like ridge augmentation and implants. There are more things that you can see. Ask from a prostho PG, they will tell you better. It's more of an intraoral, but extraoral also can be done. If you are going for maxillofacial processes, that is the fellowship later on, you can do extraoral processes also. The mainly patient flow will be geriatric patient, old age patients come to you, but also the younger age patient groups come for like RCT, processes, and other things. Higher chance of government job will be there. Fellowship in maxillofacial processes, that much I know. So you can also do a specialty, super specialty in this. They're like the masters of implant. They'll be placing the implants. They can also do the rehab of the implant, and they will also be loading the processes on that implant. My verdict with Prostho is like they are the best branch if you want to run a dental clinic. You will know all the procedures you can do in the dental clinic and treat the patient single-handedly. So if you have an aim of running a dental clinic, go for Prostho. Next question. If you answered that you don't like the surgical branches, the answer for that is no. Go for a detail-oriented branch, that is orthodontics and cons and endo. See, for orthodontics, I'll tell you, the period of treatment is very long. So if you're picking up one patient in this year, that patient will be continued for at least 2.5 years. So you will have a good number of patients within 2 to 3 years. It's more of a demanding branch. You need to read a lot of data with time. Trust me, I am an ortho PG, I know this. Patient work will come to your room. Some of the colleges, the residents are doing SEP tracings, like we are doing SEP tracings, cast analysis, image editing, and case planning. So that work will come to your room. It's not a 9 to 4 job, it's like a 24/7 job. So be well aware of that. Some of the colleges will have automatic tracings, that is the AI assisted tracings. So inquire about those colleges. Mostly the private colleges will have that facility and not the government colleges. Very high record taking will be seen in the orthodontics department. So like you will take the intraoral photograph, extraoral photographs, models, CEF, OPG, everything you have to take. So it's a demanding branch. Also an expensive branch. You'll be buying very costly instruments. Like I bought my first two pliers for like 8,000 each. A distal end cutter of 8,000. It costed 24,000 for three instruments. I'll be buying a camera. It's costing around 90,000. I'll be buying a printer. It will cost around 20,000. So it's a costly branch. The patient group will be the younger patient group, like the from the age of 10 to 30 years of age. So remember, this branch will be highly demanded in the coming years. See, what my verdict with ortho is, it's a pure specialization branch. Like patient stays for long with the dentist, and orthodontists are demanded in every clinic. The only con is it cuts you from general dentistry. Like as an orthodontist, I might not be able to practice basic procedures like extraction or RCT later on. I might forget them. So that's the only fault of it. Rest, it's the one of the best branch, what I think. Cons and endo. See, the period of treatment is very short, like RCT 2 or 3 sittings. That's the basic procedure they do. Number of patient maximum. See, in my college, what they used to say, like endo is like the bread and butter of dentistry, but ortho is like the peanut butter and jelly of dentistry. So endo will have the most number of the patients. Like out of 10, at least 8 patients are endo. Not much to read. You need not to read as much as you have to read in ortho. Patient work is pure clinical. No work is coming to your room. Patient group of all ages will be seen. The only expenses you have to made is on the instruments, files, instruments, loops. Loops are costly. Like they will be cost around 1.5 lakhs. Eroters, apex locators, they will be costly. So be aware of that. Aesthetics demand is very high of this branch. So it's a high demand branch in the coming years. See, the only thing I hate about endo is everyone does endo. Even a general dentist will do RCT. I agree. Some of you might disagree with me, but what I think, the general dentist will do a single RCT in 20 minutes, or endodontist will do the RCT in 10 minutes. That's the only difference. What I think they can do. So the advantage is that you can run a proper clinic doing endo and have a good number of patients. So if you want to run a dental clinic, need to have a good flow, go for endo. If you want to have a perfect specialization branch, want to do consultation, go for ortho. So last but not the least, you like working with kids, like general dentistry? If the answer is yes, go for Pedodontics. The patient group will be from 6 months to 18 years of age. In some colleges, still only 14 years. You learn to work on the primary and the permanent dentition both. So you know the best of the both the worlds. You learn about child psychology, so you know how to handle the patient. The only difference between a general dentist and a pedodontist will be that the pedodontist knows how to tackle the problems of the patient, how to know what is the main cause of the problem. It's a very high demanding branch in tier 1 and tier 2 cities. Parents will spend hefty amounts on the well care of their children. They won't bargain, they won't argue with the doctor, they will pay because they want the well-being of their children. Cases done under GA, some of the cases will be done under the general anesthesia, as the children won't be cooperative. So GAOT will be organized. So you will also have the idea of working in a OT. So even after these things, I covered 9 branches, 3 non-clinical and 6 clinical. If you are unsure, go back and see the previous things what I just taught you and decide accordingly. Like according to me, public health dentistry will have the most vacancies in the government job. Whenever you see a notification, see how many specialists they want. They will have the most number of vacancies for the public health dentist only. Moving on to the money making branch, what I think, OS and ortho, it takes time for them to build up the consultation, to build up the links, but with time they will earn a lot. But I am telling about the data right after MDS. The most money making branches will be cons and endo, prostho, pedo. Non-clinical will make less. Running a dental clinic, like you are going to open a dental clinic after your MDS, the best branches would be prostho, cons and endo, pedo, perio, PhD, OS, ortho, OMR and OP will be like the least of them. Just think that after doing MDS, you want to move abroad, you need to know about the scope outside India. Go for the clinical branch like OS, ortho, cons and endo. See, in some countries, our cons and endo is not valid, so you need to do our extra degree there. Pedo, prostho, and these 5 branches I think you should go for if you're thinking of moving abroad. Branches like perio, PhD, OMR, and OP should be avoided. PhD still you can opt. Indian MDS degree is recognized in UAE, this much I know. Licensing exams are required in other countries, like in UK they require ORE or LDS. In USA, NBDE, DDS, and DMD. NBDE is named as something else, just check it online. In Australia, you have to qualify the ADC. So with this, we come to the end of the video. I hope I was able to solve all your queries, and do text me when you get your dream college and branch. So all the best, and do subscribe to the channel. Thank you for watching.